Question over here.
This is really kind of in the form of a statement, and I'd like you guys to respond to it. So, in America, we spend more than any other modern society to deliver health care, which is really, I think, largely disease care, not so much health care. And that rate of expenditure keeps going up, whereas the rate of real wage growth amongst the buyers of healthcare, arguably the patients, but of course insurers really don't pay that. So what I see is, and in third, I saw a number many years ago that something around 65 or so percent of, or 65 cents of every healthcare dollar is really spent treating disorders that are lifestyle in origin, meaning the patient made choices, and of course there are genetic influences as well. But so what I'm seeing is that the costs are going up. The ability to pay for those costs is not really going up, and yet a lot of the root cause has to do with the patient's lack of awareness and appropriate involvement in managing their health. So I'm wondering, 5 to 10 years from now, is it realistic to expect that the patient or the individual before the patient really is going to perhaps need access or could use some of these mobile healthcare technologies to better manage their, not only their health, but whatever limited resources they might have to bring to bear to manage disease states? So I'd like you guys to maybe respond to that.
Maybe try to address the question maybe from a couple aspects of the patient side as well as my own business, the kind of same challenges we're facing. So as you say, I think there's a shift as well going from a company paid basis to medical to the employee itself who's facing very low wage increases over the next few years and so forth. So certainly in our company we've been seeing the same thing, 17, 18, 20% year-on-year raises, very consistent throughout the industry. Certainly we haven't seen our pay rise as much. So we are trying to be proactive in that point as well and get the people engaged. Like you said, a lot of this is lifestyle. So, for example, one of the policies we're pushing in the company, we're now pushing, you must have annual physical, for example. It's prevented, but that's a must. If you're covered by the health care, that's a given. We're incenting people to stop smoking, so we're going out of ways a separate benefit to target smoking and other areas. We are trying to be proactive in that way. I think the industry will continue to start going that way. Certainly in the petrochemical industry here, a lot of the used companies are looking at similar programs as well. Actually trying to put the burden, if you will, back on the employee. Because at the end of the day, that's what money's going to come from. We've seen the same thing in Europe, again, where a lot of there's a social medical care and so forth, trying to now go back to the employees themselves.
So let me make your concern more intense. I saw a graph in a presentation about 6 months ago, and there was one line which was the average income of a family of 4. It goes like this over the next 20 years. And the second line was the cost of health insurance for the employer and the employee over the next 20 years. And they met, which would mean that 100% of your income would go to paying for your health insurance in about 12 years under the gold system. So we're in a crisis mode right now in this country. We really need to do something different. I'm going to ask you all, if we improve quality and reduce readmissions and improve quality of care and people live longer, is our healthcare costs going to go down? No. The least expensive patient is a deceased patient. So if we keep people alive longer, the healthcare costs will continue to rise. So we have to just view this whole process completely differently. But the one thing that I find heartening, and maybe this will happen, is we spend more money than everybody else in the world on everything, not just healthcare. And we've been doing this on a credit card for the last 10 years. And we're now living, the punishment for that now as we've gone through this recession. So we just have to maybe readjust how we look at things and change our processes and try to reduce how we treat things to make them less costly. One good thing, generic drugs. There's really been no major in the outpatient arena, new drugs in the last 10 years. Most of all the major drugs are now generic. So our drug costs for the country have gone down by 30–35% in the last 7 years. So, if that technology can help us do the same thing, reduce people's costs, then hopefully there's a way of controlling this. The patient-centered medical home has documented to reduce overall costs.
just a brief statement about helping people manage their care. If you didn't know this, just knowing something doesn't mean that you do it. So nurses know that compliance is a huge issue, as well as doctors know that. So in talking about ways to manage care, it's really about ways to document you're doing the right things, I think, and having some focus on that, as opposed to just telling people what's the right thing to do. So those of you who are looking to get some smart information out there that we can use in the healthcare industry, I think some focus on that is important. It is obviously about the knowledge as well, but we need more than that.